Hello everyone, welcome back to Healthy Care. Every morning we wake up hoping our bodies will be full of energy to start a fresh day. But have you ever wondered what if those subtle sensations, those small signals your body shows, are actually trying to tell you something? Sometimes it's just a bit of fatigue, other times, it's a slight feeling of discomfort that we're quick to overlook. Yet behind these small signs might be the silent cry for help from your liver, one of the most essential and resilient organs, working tirelessly to cleanse, energize, and protect us from toxins. In today's video, we'll dive into the subtle yet crucial signals that your liver sends each morning. These aren't just random or fleeting symptoms, they're your body's way of communicating. Your liver's way of speaking up when it's working harder than usual to keep you healthy. By learning to recognize and understand these signs, you can catch potential liver issues early, making all the difference to your long-term health. This journey of tuning into and understanding your body starts now. Are you ready? 1. Fatigue or exhaustion. Persistent fatigue, especially right after waking up despite a full night's sleep, can be a sign that your liver might be in trouble. Typically, a restful sleep helps the body recharge and prepare for the day. However, for people with liver issues, no amount of sleep seems to alleviate the feeling of exhaustion. This fatigue stems from an impaired liver, which can no longer efficiently perform its role in metabolizing glycogen, the body's main energy reserve. Normally, the liver stores and releases glycogen as needed to maintain steady energy levels. When this function is compromised, the body is deprived of the energy it needs, leaving you feeling constantly tired and drained. Research from the National Institutes of Health (NIH) shows that over 65% of chronic liver disease patients experience persistent fatigue, which impacts not only physical health but also mental well-being, reducing concentration, memory, and overall productivity. Patients struggle to even get out of bed, beginning each day feeling completely depleted. This isn't mere tiredness but a profound physical and mental exhaustion that can lead to depression and a loss of motivation for life. 2. Difficulty concentrating. If you wake up feeling mentally hazy, find it difficult to concentrate, or struggle to think clearly, this could be a sign that your liver is overburdened. Often referred to as brain fog, it feels like a layer of mist obscures your mind, making everything seem vague and hard to grasp. The liver plays a crucial role in filtering toxins from the bloodstream, but when liver function declines, these toxins build up in the body and can affect the central nervous system. Harmful substances, like ammonia, when not properly metabolized, impact the brain, reducing cognitive abilities, memory, and overall awareness. According to a study published in the Journal of Gastroenterology and Hepatology, up to 80% of cirrhosis patients experience cognitive decline, from issues with memory to difficulty making decisions. Each morning, they wake up with a heavy head, unclear thoughts, and a foggy sensation. These symptoms don't just impact work performance, they reduce quality of life, making everyday tasks such as driving, remembering schedules, or socializing a major challenge. 3. Nausea or abdominal discomfort. A symptom often overlooked is mild nausea or abdominal discomfort, especially in the morning. This tends to happen shortly after waking up, when the stomach is empty and the body is dealing with the effects of nighttime metabolic processes. The liver is essential in bile production, a substance necessary for fat digestion. When liver function is impaired, bile production and release become inefficient, leading to poor digestion, particularly of fatty foods, and resulting in morning nausea. This makes breakfast challenging and can lead to worry about one's health. According to the Clinical Liver Disease Journal, about 50% of patients with chronic hepatitis or fatty liver disease report frequent nausea, especially in the morning. Furthermore, increased pressure in the liver's blood vessels, especially in people with cirrhosis, can cause discomfort in the abdomen. These symptoms not only cause unease but also lead to mental distress, causing people to worry and stress about their health condition. 4. Joint pain or stiffness. Joint pain or stiffness in the morning, particularly the sensation of difficulty moving or aching joints, can be an early warning sign of liver health issues. Many people don't associate joint pain with liver function, but it is common among those with autoimmune liver disease, and can also occur in cases of non-alcoholic fatty liver disease and other liver conditions. A damaged liver struggles to remove inflammatory substances from the blood, increasing inflammation throughout the body, particularly in the joints. This can lead to stiffness and pain, especially in the morning. A study published in the International Journal of Hepatology reports that approximately 30% of chronic liver disease patients experience joint inflammation. This pain not only restricts movement but also disrupts daily activities and causes significant mental strain. Patients may feel both physically and mentally drained due to pain that affects not just mobility but also triggers worry about their overall health. This is why people with persistent, unexplained joint pain should consider having their liver function checked, as it could be an early warning that this vital organ is in distress. 5. Dark urine. If you notice that your urine is a dark yellow color during your first bathroom trip in the morning, don't ignore it as just a sign of dehydration. Although morning urine is typically darker due to overnight water loss, if it consistently remains dark, it could be an indicator that your liver might be in trouble. The liver plays a vital role in processing and excreting bilirubin, a waste product generated from red blood cell breakdown. When the liver is compromised and unable to process bilirubin effectively, this substance accumulates in the blood and is excreted through urine, resulting in a darker color. According to research from the Journal of Clinical Liver Disease, dark urine is one of the initial symptoms observed in patients with hepatitis and cirrhosis. Approximately 40% of chronic hepatitis patients report that their urine is darker than usual, particularly in the morning when bilirubin has built up overnight. People with fatty liver, alcoholic hepatitis, or cirrhosis frequently experience this symptom. Paying attention to small changes, like urine color, can help you detect and treat liver issues in a timely manner, as it is a clear signal from your body that your liver is calling for help. 6. Dry mouth and bad breath. Waking up with a dry mouth and unpleasant breath not only affects confidence but could also indicate that your liver is overburdened. The liver is responsible for detoxifying the body, but when it weakens, toxins accumulate in the blood and gradually release through the breath. Especially in the morning when you've just woken up after a night's rest. This phenomenon, known as liver breath odor, is commonly seen in people with chronic liver diseases like cirrhosis and hepatitis. A study from the National Institutes of Health (NIH) found that up to 50% of cirrhosis patients report bad breath in the morning, mainly due to an increase in ammonia, a toxic compound the liver cannot completely metabolize. Ammonia accumulates in the blood and gradually escapes through the respiratory tract during sleep, causing an unpleasant odor. Additionally, when the liver is impaired, saliva production decreases, resulting in dry mouth, which exacerbates bad breath upon waking. Morning breath odor is an easily recognizable and early symptom, a potential warning sign that your liver may need attention. 7. Bloating or gas. If you wake up with a bloated, full stomach, this could be a warning signal from your liver. The liver plays a crucial role in digestion by producing bile to help process fats. When the liver is not functioning effectively, digestion is affected, leading to gas accumulation in the digestive system and a bloated feeling, especially in the morning. Research from the Journal of Hepatology and Gastroenterology shows that around 30% of patients with hepatitis or cirrhosis frequently experience bloating and gas. Experts explain that this often occurs in the morning due to the liver's overnight work processing substances in the body, with pressure building in the liver's blood vessels, resulting in fluid retention and gas buildup. Those with this symptom often feel heavy and uncomfortable at the start of their day, affecting their mood and productivity. Do not ignore this symptom, as it may be the liver's first signal that it is struggling. 8. Pain or pressure in the right hypochondrium. Another easily noticeable symptom is a dull pain or pressure in the area under the right rib cage in the morning, especially after waking up. This is where the liver is located, and this pain can indicate that the liver may be facing serious problems. Although the liver itself lacks sensory nerves, when it swells or becomes inflamed, it exerts pressure on surrounding areas, particularly the liver capsule, causing pain or pressure in the right hypochondrium. According to research from the International Journal of Hepatology, about 25% of patients with chronic liver disease, especially those with fatty liver or cirrhosis, report feeling pain or pressure in the right hypochondrium in the morning. This pain is often described as a persistent and uncomfortable sensation, lasting throughout the day, but particularly noticeable after a night's rest. For those with chronic liver disease, this symptom not only disrupts daily life but also causes considerable worry. Listen to your body, and don't dismiss the dull pain every morning, as it could be a sign that your liver needs help. 9. Loss of appetite or reduced hunger. If you wake up without feeling hungry or even experience a distaste for food, this could be a warning sign from your liver. The liver plays an essential role in supporting digestion by secreting bile to break down fats and provide energy for the body. When the liver is not functioning well, the digestive process slows down, and this can reduce morning hunger. This is not just a feeling of not being hungry but rather a complete loss of interest in eating. And sometimes the thought of breakfast may even cause nausea or aversion. According to research from the National Institutes of Health (NIAE), up to 60% of chronic liver disease patients experience prolonged appetite loss, particularly those with cirrhosis and hepatitis. When the liver is impaired, it cannot produce enough bile to aid digestion, leading to the accumulation of undigested food in the stomach and intestines, causing bloating and discomfort, which leads to a loss of appetite. This symptom often persists, resulting in weight loss and malnutrition. This loss of appetite affects not only physical health but also creates a feeling of weariness and irritability when starting the day. 10. Dry and itchy skin. If you wake up with dry and itchy skin, especially on your hands and feet, this can be a sign that your liver is in distress. The liver plays a crucial role in removing toxins from the body, and when its function is compromised, harmful substances accumulate in the blood and can directly affect the skin, causing dryness and itchiness. A healthy liver produces enough bile to help flush out these waste products, but when it cannot perform this function, toxins build up and cause skin issues. According to research in the Journal of Clinical Dermatology, around 30% of chronic liver disease patients report persistent symptoms of dry and itchy skin. Areas like the hands, feet, and torso are especially affected, creating an uncomfortable sensation in the morning. Studies have also shown that this itching often worsens in the morning after the liver has been working overnight to process toxins in the body. This symptom not only affects sleep quality but also leaves people feeling drained and less energized in the morning, impacting productivity and mood throughout the day. 11. Swollen legs or ankles. Swelling in the legs or ankles in the morning can be a clear sign that your liver is struggling to regulate water levels in the body. The liver not only filters toxins but also regulates albumin, a key protein that helps retain water in blood vessels and prevent fluid from accumulating in the tissues. When the liver cannot produce enough albumin, fluid readily accumulates in soft tissues, leading to swelling, especially in the legs and ankles. The Journal of Hepatology and Gastroenterology reports that up to 40% of cirrhosis patients experience swelling in their legs or ankles, especially noticeable in the morning after a night's rest. This fluid retention makes legs feel heavy and uncomfortable, affecting mobility and reducing physical activity. For those with chronic liver disease, leg swelling is not just a superficial symptom but a serious indication that the liver is in red alert status, needing immediate medical support to prevent more dangerous complications. 12. Facial puffiness or swelling. Waking up with slight swelling around the face or eyelids can be a liver warning that many people overlook. Similar to swelling in the legs, facial puffiness is often due to the liver's reduced ability to regulate fluid levels in the body as a result of decreased albumin production. This leads to fluid retention in soft tissues, particularly around the face and eyelids, areas that are more prone to fluid accumulation. When the liver struggles to function overnight, you may wake up with mild swelling, making your face appear tired and lifeless. According to a study published in the Journal of Hepatology and Gastroenterology, facial swelling is a common symptom among chronic liver disease patients, particularly those with cirrhosis. This condition not only affects appearance but also leaves patients feeling self-conscious and fatigued first thing in the morning. Morning puffiness can also be an early sign of declining liver function, so if this issue occurs frequently, it's a good idea to consider a liver health checkup. Early detection can help you avoid serious complications down the line. 13. Pale stools. The color of your stool is another important indicator of liver health. Pale stools, especially in the morning, can be a sign that your liver is not functioning well. A healthy liver produces bile, which gives stools their characteristic brown color. When the liver is impaired and unable to produce enough bile, stools tend to become lighter, even clay-like in color. Additionally, if the bile ducts are blocked due to inflammation or cirrhosis, stools may contain mucus and be noticeably lighter. Research in the Clinical Gastroenterology Journal reveals that pale stools are one of the first signs of liver disease, seen in about 20% of chronic liver patients. If you notice pale stools, particularly in the morning, accompanied by dark urine, This is a warning that the liver is struggling to process fats and toxins. Monitoring stool color each morning can be a simple yet effective way to detect early liver issues, allowing for timely intervention to prevent serious health complications. Our bodies have their own unique way of speaking up, sending warnings when something's not quite right. Those small signs we often overlook each morning can carry important messages from our liver, the silent yet vital organ working tirelessly within us. Recognizing and listening to these signals early on can help you protect your health and lead a better, healthier life. If you found this information helpful and want to join us on this journey of health and wellness, don't forget to hit the subscribe button and turn on notifications so you never miss a video from us. Let's build a healthier life together, starting with the smallest actions. Thank you for watching, and we'll see you in the next video.